Alright, so you're doing the patient assessment management medical station. You have 15 minutes to complete this station. You're dispatched to a 60-year-old male with altered mental status who has been vomiting.
Alright, so I want to determine scene safety and BSI precautions are taken. Now I want to determine number of patients.
One patient.
And then I want to determine mechanism of injury and nature of illness.
Vomiting and altered mental status.
Okay, and I want to also consider additional EMS assistance if necessary. And then I also want to consider stabilization of the spine.
Okay, no injury, no need to stabilize.
Okay, so now when I enter the scene, I want to get my general impression of the patient.
Patient sitting on the couch, moaning, mumbling his words, and he had just recently vomited.
Okay, I also want to determine level of consciousness using the ACBU scale. So are they alert to my presence? Are they alert to verbal stimuli, painful stimuli, or are they unresponsive?
Alert to verbal.
Verbal stimuli, okay, and I also want to determine any chief complaints or life threats.
No life threats right now. The chief complaint is patient started vomiting this morning, and he has become increasingly confused throughout the day.
Okay, I want to assess airway and breathing now, and I want to make sure I assess I want to make sure there's adequate ventilations, and then also if oxygen is needed.
He's ventilating appropriately, no oxygen needed at this time.
Okay, and I also want to assess circulation, control any major bleeding going on. I want to check a pulse, and then I also want to check the skin color, temperature, and condition.
Pulse is present at a rate of about 98, no major bleeding, and skin is cool and pale.
Okay, so I want to now, based off all this information, determine transport priority. Because of this information, I would say we can stay on scene and continue their assessment.
Okay.
So I would move on to history. Now I want to assess OPQRST, onset, provocation, quality, severity, radiation, and time. So onset, a question I can ask is, did this happen gradually, or did this happen all of a sudden? For provocation, I can ask what makes it better or worse. For quality, I'll ask them what are they feeling? Can they describe what they're feeling to me? For radiation, is their pain or what they're feeling moving anywhere else in their body, radiating anywhere else? For severity, I can ask on a scale of 0 to 10, 10 being the worst pain you ever felt, what would you rate this? And then time, when did this start? Now I want to also move on to their history too, so I want to ask, are they allergic to any medications?
No allergies.
Do they take any prescribed medications?
Insulin and metoprolol.
Okay, and then what is their past pertinent medical history?
Diabetes and high blood pressure.
Okay, and last oral intake?
This morning he had some breakfast, but he threw it up.
Alright, and then what was he doing when this happened?
So he woke up this morning, he took his blood sugar, he took his insulin, and then he had some breakfast, he vomited that, and he's been vomiting throughout the day, so he has not been able to eat anything else.
Okay, so now I can actually move on to secondary systems that are affected. So based off this information and altered mental status, I want to check his pupils, I want to check his blood glucose, and I also want to do a stroke scale and check LAMS.
LAMS is 0, blood sugar is 45, and pupils are equal and reactive.
Okay, so now I actually want to move on to vital signs. So I want to check his blood pressure, respiratory rate, and then I want to check his pulse.
Blood pressure is 110/60, pulse is 98, respirations are 12.
Okay, so now I want to state my field impression, and based off this information, I feel as if this patient is having a diabetic emergency, hypoglycemia. So I want to now start my interventions, which would be to administer glucagon due to his level of responsiveness. So I would administer 1 milligram of glucagon IM, and I would want to reassess his vital signs, specifically blood glucose.
Great.
So what is his blood glucose now?
It is now 115.
Okay, so now then I would reassess his vital signs every 5 minutes throughout the transport, and when I get to the hospital, I would state my report to the nurse. I would say I was dispatched to a 60-year-old male with altered mental status who has been thrown up. It is now 5 o'clock in the afternoon. The last time he ate was earlier this morning. He did take insulin, and he is a known diabetic, and he did have a low blood glucose of 45. I did administer 1 milligram of glucagon IM. His blood glucose is now 115. Vitals were all stable throughout the transport. LAMS were 0, pupils were pearl, no other symptoms or abnormalities.
Great. And that completes our station.
Okay.